Hello, I'm Dr. Bang, the magician who protects your hair. It's a pleasure to meet you. Even if many people around you have undergone a hair transplant, the progress and process can vary slightly for each patient. Just think of it like planting a tree. You plant a seed in a flower pot. Well, it'd be great if something grew the next day, but it might not, you see. The growth speed and quantity can differ quite a bit. Some people are deeply moved just by seeing a sprout appear. But for some patients, it's natural for it to emerge, but they feel it's only meaningful if it grows and grows and then blossoms into a flower. In truth, it varies so much for each patient. Just as a tree doesn't grow immediately after planting, transplanted hair doesn't either. But hair growth involves a shedding process. When biological tissue encounters other biological tissue, they naturally begin integrating smoothly. However, when a hair follicle is relocated to a new site, it sheds its original hair shaft because it appears to be too burdensome to maintain. We usually call the first 1, 2, or 3 months after the transplant the shedding phase. This is when the hair falls out. The transplanted hair sheds. This can make you feel down and depressed, but this shedding process is normal. But if that's explained clearly, the patient will understand. The actual problem then becomes the appearance of the hair when it regrows. What you all need to understand is that when you plant a tree, it doesn't start out thick, does it? It starts thin and gradually gets thicker as it grows. Hair is the same. It's thin at first. Because it's thin, it lacks strength, and because it lacks strength, it appears bent. That's what many people perceive as frizziness. Doctors have seen this frequently, so we reassure patients this degree of frizziness is acceptable given your hair's thickness. However, patients often experience anxiety because, from an aesthetic standpoint, the appearance is neither pleasing nor natural. To be perfectly honest, there have been cases where frizziness became a problem. These patients often have issues with transplant depth. When performing the transplant, if it's implanted too deep, frizziness can occur. Because when the hair follicle tries to exit the skin, it should push straight, but it rotates or bends inside before emerging. So when it finally breaks through, it should be smooth, but it's already bent from the inside. Patients sometimes say it's growing like pig bristles, and if it's that kind of frizziness, well, they really hate it. However, the type of curly hair I'm currently referring to occurs because the transplant depth is appropriate, but the hair is still quite thin and lacks thickness as it emerges. If you're uncertain about this distinction, you ought to schedule a follow-up appointment. You should go to your surgeon and ask, will this frizziness get better? When you ask, the doctor will examine it and say, this frizziness is due to the hair being thin. It will get better as it thickens. Then you can feel at ease and simply wait. But doesn't the time for hair to thicken vary for each patient? Most patients see frizziness resolve in 3 months, though some take 6 months or a year. If your hair is naturally on the thinner side, you can expect the frizziness to last a bit longer. If you have thicker, stronger hair, the frizziness will straighten out a lot after 6 months. If it's still very curly by that point, then you and your doctor need to have an in-depth consultation. What exactly is the problem? Is it an issue because the hair isn't thickening? Or is it an issue because the transplant depth you used was improper? We'd have to determine that, but honestly, even I'm not entirely sure. I've actually seen hair that was quite frizzy normalize after being plucked a few times. You just need to observe it with a bit more patience, particularly the frizziness. Alright, today we've gone over the hair transplant process and some of the uncomfortable side effects that can arise. I truly hope this information was helpful to you. Thank you.